What if I told you that 1 in every 9 adults walking around right now has diabetes? The latest numbers estimate that's nearly 589 million people between the ages of 20 and 79. But here's the truly shocking part. According to the International Diabetes Federation, over 4 in 10 of them don't even know they have it. We're talking about a chronic condition that changes the way your body powers itself. So, what's actually going on inside? If you just ignore it, diabetes can cause devastating damage to your heart, blood vessels, eyes, kidneys, and nerves. But, and this is a huge but, it doesn't have to be that way. For so many people, it's manageable and in some cases even preventable. So today we're going to break it all down. The different types, the sneaky symptoms to watch out for, and the powerful treatments and lifestyle changes that literally put you back in the driver's seat. Okay, so to get what diabetes is, you first need to understand insulin. Imagine your body is a busy city and your cells are all the houses and buildings. They all need energy to keep the lights on. When you eat, your body breaks a lot of that food down into sugar or glucose, which is the main power supply for your cells. This glucose travels through the city's power lines or bloodstream, but it can't get inside the houses on its own. It needs a key. That key is insulin, a hormone made by your pancreas. Insulin unlocks the door to your cells, letting the glucose rush in and provide energy. Diabetes is what happens when this whole system gets messed up. Either your pancreas stops making enough keys, or any at all, or the locks on the doors get rusty and the keys don't work anymore. That's called insulin resistance. Either way, the glucose gets locked out, building up in the bloodstream where it doesn't belong, and that's when you get high blood sugar. So, high blood sugar is a core problem, but it can happen for a few different reasons, which brings us to the main types of diabetes. First up, we have type 1 diabetes. This is an autoimmune curveball where your own body's immune system gets confused and destroys the insulin-producing cells in your pancreas. No insulin, no keys. People with type 1 produce little to no insulin on their own, so they need to take it for life. Its symptoms often show up suddenly, typically in children and young adults. Then there's the one you've probably heard the most about, type 2 diabetes. This accounts for over 90% of all cases. With type 2, your body's either not using its insulin keys correctly, that insulin resistance we talked about, or it just can't make enough insulin to handle the job. This usually creeps up over many years and is often diagnosed in adults, though we're seeing it more and more in younger people. And we also have to talk about gestational diabetes, which happens during pregnancy. The hormonal changes can interfere with how insulin works, and while it usually goes away after the baby is born, it's a big warning sign that the mother is a higher risk of developing type 2 diabetes later on. There's also a critical warning stage called prediabetes. This is where your blood sugar is high, but not quite high enough to be diagnosed with type 2. Think of it as a final boarding call. It's your best window to make changes and prevent the full-blown disease. So, how do you know if you have it, especially when so many cases go unnoticed? You need to know the signs. The classic symptoms are sometimes called the 3 Ps. First, you're incredibly thirsty, polydipsia. Second, you're running to the bathroom all the time, polyuria. And third, you're suddenly starving, just ravenously hungry, polyphagia. Beyond that, look out for things like losing weight without trying, feeling wiped out all the time, or having blurry vision. With type 1, these symptoms can hit you like a truck, developing fast over just a few weeks. But with type 2, they can be so gradual that you might not even notice them for years. You might just feel a bit off, or maybe notice that cuts are taking forever to heal, or you're getting more infections. Okay, so if you've been diagnosed, what's the game plan? Here's where we get to the empowering part. Diabetes is a condition you can absolutely manage, and the foundation for managing all types of diabetes is lifestyle. For some people with prediabetes or even early type 2, lifestyle changes can be so powerful they can put the condition into remission. It's important to use the term remission because reversal implies a permanent cure, which isn't accurate. And we have proof of the power of lifestyle. The landmark diabetes prevention program study showed that losing just 5 to 10% of body weight and getting 150 minutes of brisk walking a week could slash the risk of developing type 2 diabetes by an incredible 58% is huge here. And no, this doesn't mean you have to eat boring, joyless food forever. It's about building a smarter plate. Load up on non-starchy veggies, get your lean protein, choose whole grains, and cut back on processed foods and sugary drinks. Now, when it comes to medication, it really depends on the type. Type 1 diabetes always requires insulin, either through injections or an insulin pump. For type 2, the first step is often an oral medication called metformin, which helps your body use insulin better. But in the last few years, we've seen total game changers emerge, like GLP-1 agonists and SGLT2 inhibitors. These newer drugs not only help control blood sugar, but can also lead to weight loss and even protect your heart and kidneys. Living with diabetes is a marathon, not a sprint. It takes awareness and daily action, but it absolutely does not have to define you. When you understand what's happening in your body, learn to spot the symptoms and get proactive with your diet, exercise, and the right treatments, you can live a long, vibrant, and healthy life. And if you're in a position to help others who may lack access to this kind of care, Please consider donating to my fundraiser for Doctors Without Borders. They do critical work providing medical aid in over 75 countries to those affected by conflict, disasters, or exclusion from healthcare. Link is in the description below. Diabetes is serious, there's no question, but with the right knowledge and the right team behind you, you are the one in the driver's seat.